Good afternoon. Welcome to today's Wisconsin Health News virtual event on the state of nursing in Wisconsin. My name is Tim Stum. I am the editor of Wisconsin Health News. Thanks to all of you for tuning in. We have a great panel of speakers with us today to talk about a very important topic. I am thrilled to introduce Linda Young, Dean Emeritus of the UW-Eau College of Nursing and Health Sciences, Representative Rachael Cabral-Guevara, a Republican from Appleton, Gina, Dennik-Champion, Executive Director of the Wisconsin Nurses Association, Nancy Korom, Chief Nursing Officer for Children's Wisconsin, and Pat Raes, President of SEIU Healthcare Wisconsin. Before we get started, I want to make sure we thank our very generous sponsors of the Wisconsin Health News virtual series. This is a new series for us. When we first switched our events to the virtual format 2 years ago, we really weren't sure how they'd be received. Since then, we've really been blown away by the reception. We're certainly excited to bring many of our events back in person this year. We had a great turnout last week with DH Secretary Designee Karen Timberlake, and we really look forward to reconnecting with more of you in 3D in the months ahead. But even as we do that, we've realized there still will be a place for these virtual events, which have allowed new people from across the state to tune into our programming. So a huge thank you to the sponsors of our debut Wisconsin Health News virtual series, Advocate Aurora Health, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Gundersen Health System, Hush Blackwell, and WPS Health Insurance. Thank you also to Badger Bay Management for helping host today's event in partnership with Wisconsin Health News. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like this, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. I want to give an extra thanks today to Anthem Blue Cross and Blue Shield of Wisconsin, today's featured sponsor. We are very grateful for all of their very generous support. Here to say a few words today is the president of their Wisconsin Medicaid plan, Ted Ostelder.
Thanks, Tim. Hi, everybody. Ted Ostelder. It's a privilege to be here today to represent Anthem Blue Cross and Blue Shield in Wisconsin. We're grateful to be presenting sponsor of Wisconsin Health News virtual event series with today's conversation on the state of nursing. As usual, Tim, you had a great panel lined up to examine the challenges that nurses are currently facing today in our state. Today, over 80 years from our founding in Milwaukee, Anthem Blue Cross and Blue Shield is dedicated to being a lifetime trusted partner, improving lives of our members in the communities where we live, work, and serve. Our purpose, improving the health of humanity. At our plan, our team of nurse case managers work every day with high risk and vulnerable members to help them navigate the system for appointments in person or virtually, or to assist in getting and staying on their medication. Our teams are also constantly reaching out to our members to check in on their housing needs or on their access to healthy food and other social drivers of health. As we deliver on our work in collaboration with our provider partners and community-based organizations, we celebrate all nurses and their dedication and commitment to this important work. As we face the challenges of the COVID-19 pandemic, the Great Resignation, the aging population, and the workforce shortage, this conversation today could not be more timely and more important. Nurses and frontline workers have been the true heroes of service during the pandemic. They've shown selfless dedication and courage throughout. On behalf of myself and from all of us here at Anthem, to all nurses, thank you for your compassion and commitment and for making a difference every single day. Tim?
Excellent. Thank you, Ted. Great words to get us started off on. And thanks again to Anthem for all of your very generous support, helping make discussions like this possible. Thanks again to our panelists for sharing some of your valuable time with us today. Wisconsin's nursing workforce is at a crossroads. Burnt out by the COVID-19 pandemic, nurses are leaving the field, while those that remain are calling for better working conditions and more responsibility. Registered nurse vacancies are the highest they've been since 2005, according to a recent workforce report from the Wisconsin Hospital Association. Meanwhile, a lack of nursing educators is creating a bottleneck in the workforce pipeline. We've assembled a great lineup of panelists to talk about these issues and more. As always, our time is limited, so I am going to dive right into the questions. And Linda, let's start with you. What is the state of nursing right now in Wisconsin, just in terms of workforce and morale?
Well, I think I can speak from a personal perspective. I've just left the unit where my husband's getting chemotherapy today, and I've been involved in that environment. One of the nurses told me they are to have 7 nurses on the night shift, and they are operating with 3. So she was saying that morale has been impacted. The morale of nursing faculty, I can tell you, has been greatly impacted because during COVID, we as the faculty have been adding more responsibilities in UW system nursing programs. We took on the responsibility of vaccinating, participating in vaccinations across the state, testing across the state, and that's both nursing and faculty, or nursing students and faculty, in addition to their usual workload. Workload is very high because most of the programs in the state of Wisconsin, nursing programs, no matter what level of program, are operating on a skeleton staffing.
Thank you. Pat, what do you think? You are, in addition to working for SEIU, you're a float nurse at Merritt Hospital in Madison. What do you think the state of nursing is right now?
I'll apologize right now for my dog, but we are in a world of hurt. Nurses right now are stressed beyond stressed. The pandemic itself caused a time when we couldn't get away from it because we dealt with it at work and then we had to deal with it at home. And then you turn that around and now we're dealing with the after effects of a lot of burned out staff. You know, nurses will take pay cuts, they'll take healthcare cuts, but you start putting our patients at risk and you put us at risk of moral injury, which leads towards people leaving because it hurts us in our hearts when we can't take care of our patients like they're our family members. And with short staffing, short CNAs, all of those have a massive impact to our ability to care for people like we would like to.
Thank you. Nancy, how has the COVID-19 pandemic impacted the workforce? What are you seeing at Children's? Have you also lost nurses? And if so, why? Why do you think they're leaving?
Yeah, thanks, Tim. I think the COVID impact has been profound in the last couple of years. COVID has taken an emotional, professional, and really a mental burden on so many of our nurses. I will state that, you know, COVID did not impact children as much as it did adults from the hospitalized setting. We have taken care of COVID patients, of course, in the outpatient setting, et cetera. But I think the biggest impact that I see nursing, and I'll talk from children's perspective, but I think this has been throughout our healthcare organizations, is that COVID caused us to get in rapid change every day. There was something new. COVID was so unknown what was going to be, and we were really driven by CDC giving us guidelines for how to work. And when we went in conservation mode of PPE, that caused us to really think differently about how we provide nursing care and who works from home and who can't be in with the patients any longer. So our challenges became very different than they had been previously. Nurses took on roles of many of our other colleagues because those folks could not go in the room with the patients to conserve PPE was our original need. And then I think the challenges of COVID on our nursing in the state of Wisconsin is think about those folks who are baby boomers and then those who are millennials and Xers. We have children at home. We have children we are responsible for. So not only am I accountable to my work, I'm accountable to caring for my children and now teaching my children and doing that and trying to balance work and home in such different ways. I think the biggest impact has been fear of the unknown. When is this going to get over? What does my future look like in my career as a nursing, which I love dearly? And what is it going to mean for me, which has caused people to really rethink. So I would say the impact has been profound and with all of those multiple factors that have come our way.
Thank you. Gina, as we talked about in WHA's recent annual workforce report, they said that there are currently unprecedented levels of vacancy rates for nurses right now. Partly, this is due to COVID and the exhaustion and other factors caused by the pandemic. As COVID starts to hopefully wane, do you anticipate maybe some of these vacancies decreasing, or what are your thoughts on that?
Thank you, Tim, for the question. So the COVID beds, or the people in the beds are fewer and fewer. But what we're seeing are those people with their chronic diseases and illnesses that have put off seeing their physician or even doing a telehealth visit. And now they're in those beds and are pretty sick, I would say. This is what I'm hearing, that their intensive care needs is because of multiple system failures, and is also just as stressful to the nurses. I am hearing that the vacancy rates, even as last week, continue to be quite high. Nurses have left. We know they're looking for where the grass might be greener, or at least maybe the pay, and hearing that, our staffing agencies are now offering benefits. So they really are becoming an employer, so to speak. But I think the environment in itself, there are some things we think we can be done to help maybe bring back or retain our nurses.
Thank you. Representative, what do you think? How would you describe the state of nursing in Wisconsin right now?
I would sum it up in 2 words. Nurses, in my view, are very frustrated, and nurses, in my view, are very tired, and on 3 different levels. So we got physically, they're exhausted, overworked, mandated. Staffing ratios are a concern, right? Mentally, I see nurses are struggling for themselves, but also for their families. And then lastly, their patients. So on a mental level. Now, another life that I live beyond being a nurse practitioner, though, is politics. And I think politically nurses are struggling also. The amount of emails that I have received, the amount of nurses that have reached out to me, for me personally, it's the first time that I have seen such an engagement with the nursing population. And I think eyes have been opened on how politically healthcare can be affected. And so many nurses are becoming outspoken and advocates within the world of politics, which is new for them also. So I think people are frustrated and tired overall, and they're looking for greater change on another level that maybe they haven't explored before.
Do you think, just to follow up on that, as some of these issues are coming maybe more to the front, that politically nurses are gaining a larger voice maybe than they have in recent years?
I have to say there are 90,000 nurses in Wisconsin. That is a humongous voice. If everybody would come together and stand strong, we could make such a big impact. I would have to say, though, over the years that I have been involved, I haven't seen such a strong voice from nurses as a whole. I have from Wisconsin Nursing Association or ANA, which are amazing organizations. But when you look at the enrollment in these, is this truly representative of all of the nurses? If all 90,000 would speak up, it would be amazing. But in regards to engagement overall on an individual basis, people reach out to me daily and say, I have never contacted my representative before. I have never come down and testified on a bill before. What is this bill that you're doing? Can we put this bill together? And the large majority of everybody that reaches out to me within the world of nursing has never engaged prior. And so this is a time, this is an opportunity for people to come together and raise our voices and stand strong with WNA and the ANA. This is a call to duty here, a call of action from me, that this is your time to be heard. Great.
Linda, to kind of shifting gears a little bit, as has been well documented, there is a nursing shortage in the state. To graduate more nurses, to get more nurses in the state, we need enough teachers to teach them, which right now is not the case. Can you talk about the nursing faculty shortage in Wisconsin and the impact that is having on the workforce?
Thank you for that question. I can't state enough what a dire situation we're in, looking at the nursing faculty shortage and knowing what the demand is out there. So the other hat I wear, I lead the Wisconsin Center for Nursing Education and Nursing Faculty survey. And our latest survey results have just been published. We're not making much progress. We in Wisconsin, compared to the surrounding states of Minnesota, Iowa, Illinois, and Michigan, have the highest nursing faculty rate. We're pushing 10%. And that's very concerning. We are seeing faculty retiring. The 51% of faculty are 50 years and older. And people are leaving earlier than they had planned. COVID has pushed that as well. And what we're seeing is a decrease in PhD students and graduates who teach in baccalaureate, master's, and doctoral programs in Wisconsin. And we're unable to take the number of qualified applicants who are applying to our nursing programs. And let me just give you one example.
Yeah, sorry, do you have that number, like about how many nursing students a year are turned away in Wisconsin?
Yeah, we turn away over 1,000 qualified nurses annually in the state of Wisconsin who apply to nursing programs. And my situation at UW-Eau Claire, they may have a 3.5 and other things to bring forth in their application, but there are so many more applicants above them in terms of grade point and other variables we look at, they don't get in. And so there is this large pool annually of qualified nursing students that we cannot accommodate. And clearly, I always think of it as the bow tie. There's the demand from the students, and what we're seeing is numbers are not going down in terms of applications into nursing. They're actually increasing here in Wisconsin. And at the other side of the bow tie, we have our nursing workforce, which is needing the graduates. And the problem is that not in the middle. We have too few nursing faculty. And for many reasons, not able to teach those who are qualified and want to become nurses.
And is pay one? I mean, is this all about pay, or what else can be done to boost?
That is the number, from the survey, and this has been a repeated phenomena. It's the pay in nursing education. A nurse, let's say, as an example, our representative here on this panel, she's a nurse practitioner with a master's degree. She could be teaching in ADN or our BSN programs with that degree background. She would be making 25% less, at least, than what she would make in her healthcare position. So healthcare organizations are paying much more for our masters and doctorally prepared individuals than are the academic environments.
So would decreased maybe requirements be helpful to teach? I mean, would there maybe it was not as much a reliance on the graduate level training to teach registered nurses, or what are your thoughts on that?
Well, I would like to push that back to our panel, because from where I stand, if we did that, we would not be able to graduate the doctorate of nursing practice, which is where that NP is going. We would not be able to graduate our PhD students, because they need to have faculty who are researchers, right? And master's prepared, that affects ADN programs as well as baccalaureate programs. So if we did not push for graduate degrees and really address that issue, we would see the consequence to the workforce, and not only the workforce, but specifically to the academic environments. We did this with Be Bold 1, 2, and 3. The organization, and I sat in that group, determined that LPN and ADN programs should get funding. So in the survey, we have seen a bump up in the 1 year, the LPN graduates and the ADN graduates, because there's money out there for them. We need to continue to do that with the other degrees. And if I could, I would just like to add on the comment that the representative highlighted, and that's involvement in legislative activities. And the nursing educator leadership in Wisconsin with the Wisconsin Nursing Association went forward to ask for $10 million to help fund nurses to degrees of a master's in nursing education or a doctorate in nursing practice or PhD, and worked legislatively and in the context of educating as well, why that's necessary. We were delighted to receive $5 million of that $10 million ask. And I agree, there is much more interest now in becoming a voice. And I celebrate that.
Yeah.
Great. Representative, I want to bring it to you. You worked as a clinical instructor for, I think, nearly 7 years at UW-Eau. 13. I apologize. 13. Well, what more do you think can be done to get more to boost our teaching faculty?
Well, I want to slightly take a different approach to what was just commented. While I did work at the University of Oshkosh, I also had the opportunity to be the chair of admissions. And what I saw is, yes, we were unable to take in all the students that applied, but one of the challenges wasn't just the instructors, which I'm going to put a plug in there. My big ask for the budget last session was for that funding for the nursing programs, because I know how essential that was. So I was very thankful to see that get passed in the budget. But one of our biggest loopholes or our areas of concern was preceptors. So instructors are one thing, but then to get a preceptor or to get a precepted site like a hospital or a clinical site, that was also very, very challenging. One thing that I'm currently working on is we are putting a bill together right now to look at tax credits for preceptors in the state of Wisconsin, because that is very challenging to get somebody to commit. As a nurse practitioner, I'll tell you this week, and it's only Tuesday, I've had 3 emails from nurse practitioner students looking for preceptor sites. They want to come and work under me to get their hours so that they can get certified and graduate from their programs. The bottleneck is not only the instructors, which is an issue, but in my view, from the research I've done, it's the preceptors that take them on to get those hours to graduate, and it's the preceptor sites. So this small bill that I'm working on would bring in $1,000 credit to anybody per student that will, or $1,000 credit per student that a preceptor would take on. And that might be an incentive, because not only do I have to see my patients, now I also have to work and train with a nurse practitioner student. That brings extra work also. And so I think there's multifaceted levels that are contributing to this area of concern here. But I do believe that there are some things that can be done to address it.
Nancy, what more can health systems do to expand the number of clinical sites and preceptor sites?
Yeah, thanks, Tim. I am sitting here thinking we are all in this together. We really are. And so I love student nurses. We love student nurses here because they are our future workforce. And when they do clinicals with us, we can handpick who's going to love to do the type of work that we do at Children's with Pediatrics. I think everyone is outlining the challenges, and it is, how do we create more preceptorships? And we have opened up more units, different times of day, weekends, different sites. Sometimes it's in a primary care. You know, surgical services behind the doors for a full semester had never been there. We open our doors to surgical services clinicals. So I think we as healthcare organizations need to really help and provide those sites. I will say our nurses love to be preceptors, whether it's for clinical rotations or if it's one-on-one. The challenge is kind of, as Linda stated, is clinical faculty. They're not always out there. So schools of nursing come to us and say, we need to bring a clinical of 8 students to you, but we don't have a clinical instructor. So how can we help? And I will say we do use our advanced practice nurses in our organization to say, will you contract with the school for this semester to take that clinical rotation? And it is quite fun. And we have a subset of our advanced practice nurses who love to do that. I think we all have to come up with some innovative ways to do that. Some of the other things that you've talked about is, I talk to every new nurse here. I speak at new nursing orientation and round quite a bit, and nurses do want to go back to school. It's desirable to be an entry-level nurse at the bedside for however long they choose, and many people have a career path chosen. That's the beauty of nurses, and we need to keep people in nursing. So how do we support them, as was just stated, with perhaps more tuition reimbursement so that we can get people who can get their master's, PhDs? Linda is absolutely right. There are some standards of who can teach who to get the next level of degrees. And, I think let's support our nurses that are in our workforce to really get that career path that's next. Tuition reimbursement is in everybody's budgets. It's never enough to cover everything. So nurses struggle. Do I want to do this or not? And I think, we're going to get to it again, is why do they perhaps leave the workforce? If they can't meet their career goals, that might be a part of it as well. But I will just state, we are in this together, and I love student nurses. I love nurses who will say, I want to advance my career. So let's mentor and provide the right preceptors. And we need to support that in our healthcare organizations as well.
So Nancy, a growing number of nurses are leaving their health systems or hospitals to become travel nurses, where they can sometimes make double, maybe even triple their current salary. I know that travel nursing is not a new thing, but are you seeing more nurses leave for this than you have in the past? And if so, why?
Good question. I will say at Children's Wisconsin, we are not seeing droves of people leaving to become travelers, but I do know it is an issue in our healthcare organizations. So why is that? When you look at data of who are our nurses in the state of Wisconsin, Rachael already talked about the number of nurses. 30% are 55 and older. So that means those are the people who are either looking at retirement very soon or are planning. And then there's the Gen Xers and the millennials. These are folks who don't have their families and can say, boy, if I can have that opportunity to make more money, I may go travel and then figure out where do I want to settle. And I think, some of the how do we solve that issue? I really think it's about making our organizations a great place to work. It's about our culture. It is about how we treat each other as teams, and not just nurse to nurse, but our providers, our respiratory care practitioners, our social workers. We are one big team. And then nurses go into nursing because they think it's going to be a really amazing career. And it is. And it is. We have the honor of working with patients and families in ways that nobody else does. But we have to make our organizations attractive and have, so if you can recruit and retain so that you have enough staff, so they're working side by side with enough staff. And then I do believe culture is a huge part of it. We're not always going to control generally it's the younger nurses who want to go travel. It's people who don't have a commitment in their hometown. Make it so that they want to come back to us one day and have those conversations about, sure, go give it a try. They're usually in 13-week stints with traveling organizations. Go do a couple of stints and the door is open to come back, and make sure you have a plan. I don't think we're going to stop the traveling totally, but we need to stop the bleed and keep our nurses in Wisconsin, especially because that's where they're from here. They are trained here for the most part, and we need to do service to our state of Wisconsin.
Thank you. So, Representative, I see your hand is raised. I want to pull in Pat, then we'll kick it over to you. Pat, what are you seeing where you work? Are you seeing more nurses move on to staffing agencies?
We are. We see a fair share of nurses go to upper education programs, and then we've seen a large increase in nurses go to traveling because they can pay off their student loans. They can get down payments for houses. They can take advantage and travel the world and work while they're doing it. And then, we hope that they'll come back. but it's not as likely as we would like to see it. But the hospitals have to find ways to entice people and retain. And that's one of those challenges that we have been talking to our employers about for multiple years, even before the pandemic, because we saw retention being a major issue. Better retirement, better things, tuition assistance, tuition paybacks. I like the idea of the preceptors because that will keep people in. Ways to help nurses become bigger and better at the bedside, because there are lots of ways. And, the political realm and working is also one of those ways. But we have to keep our nurses at the bedside. We have some incredibly skilled people, and there's more jobs out there that don't have weekends, holidays, and overnight work. And so that's very enticing to some of the Gen X and the Gen Ys as they're developing their families. So how do we find or create jobs that can keep them in the hospital, but yet be more accommodating to a lifestyle that many of the younger generation wants?
Thank you. Representative, what do you think? What do you think is driving more nurses to staffing or travel agencies?
Well, I wear many hats. When I'm not doing the political hat, I do own a clinic in Appleton, and we do a lot of health. So hundreds of traveling nurses from my region have had to come through my clinic for different services prior to starting their jobs. And I have made it a mission to poll them because I'm very interested in this. I've been approached by numerous people to write bills that will cap wages for nurses in Wisconsin because they feel that the cost is so extraordinary that they're not going to be able to keep up with these costs. So
what do you think about that? That is something that's happening in other states, looking at capping the profit of these agencies. What do you think of those approaches?
I'm hesitant because when you put that cap on there, you're going to find people will go to other states where they're going to make more money, right? Now, do I think, nurses should be, some of these nurses are making $100 to $200 an hour, which is amazing, right? But how is that sustainable when a nurse practitioner or a physician is at that same rate, okay? So it's something to still be explored, but there is concern there as a business owner. How can I pay a nurse $100 to $200 an hour when that's also what I'm paying my physicians and my nurse practitioners? So I don't have a fix for that. I haven't taken up these bills and authored them, but people are coming and saying, what do we need to do here to get a grasp on this? Now, to answer the question prior, as I've polled people, two things repeatedly have come up and up and up again in the folks that I have polled. The first one is pay. I mean, I have, 25-year-old nurse.
Oops.
Literally $10,000. That is amazing income. The other thing that they always say is the flexibility in scheduling. They're able to get a contract for 12 weeks, which they go and work very hard on. Physically, mentally, they are so strained, but they know that maybe 12-week contract is coming to an end, and they have made enough money so they can take off 2 or 3 months to regroup, to reconnect with their family, to get stable again, to go back in for another contract for another 12, 15 weeks. The nurses are drawn to the money. The nurses are drawn to the flexibility. They know they can do their job, but they need a respite moment where they can regroup and not get fired to come back in for the battle for the next contract that they get. So for the hundreds that I've interviewed, those are the two issues that need to be addressed: pay and also flexibility in scheduling so that they can have their own self-care to help effectively care for the patients that they're working with.
Thank you. Pat, sorry, Gina, please.
So are you okay, Pat?
Yeah.
Okay. So the reasons nurses are leaving, other pieces that have certainly come to, the top. We did a survey about extent of verbal abuse toward nurses. And regardless of where nurses were working, the hospital, long-term care, in the schools, public health. Every single one of them talked about how within the last 2 years, it has gotten worse in terms of the abuse. Now, I know we've had a bill that passed in 2019 that called out a felony for anyone that physically creates battery to a nurse. And we just had another one passed that was that looked beyond nursing. But with the verbal abuse, you can't make that a felony. But at the same time, when we asked nurses what happened when you report it, the majority said, I didn't report it because I didn't think anything would be done. And I think when as Nancy was talking about the culture of organizations, that could be, one piece. I think the other thing that we're seeing with the new grads is how do we retain them? I think they're in there and I really do think if we can get every organization to put in either with a longer onboarding process or a nurse residency program and help support the organization somehow to get that to happen. The preceptor, I've talked to the representative about this, and we would like to see the tax credit for nurses that are precepting the undergrads. They too are putting a lot on the line in terms of having to take care of their patients. There's always a nursing instructor, yes, but it's, caring for the patient, teaching that nurse. But there was a case on one of the national radio stations about a nurse that is going to be charged criminally for giving the wrong med, and it was an awful med. We had that experience back in 2000, similar situation, but she too was training. She too, it's the system failures. And if we can figure out those root causes, but I think nurses are also feeling that as their patient assignments get bigger, they feel that if they're not well rested and if they're stressed, they could lose their license for an negative outcome to a patient.
So Gina, let's stick with you. Speaking of legislation, you've been very involved in a bill currently sitting on the governor's desk that would overhaul licensure for advanced practice nurses and allow them to practice more independently. Can you just briefly summarize what this bill would do and why you think this is needed? Sure. So
most states have a separate license for the advanced practice registered nurse. In Wisconsin, it's either an LPN or you're an RN. And we do know that we're all learning that the roles of these advanced practice nurses, they have more education, clinical experiences, and with that comes the accountability and the responsibility to that role. So that is why we want them recognized in state statute so that our boards of nursing or the public begin to be aware of what the advanced clinical experience of these folks and what they can bring to increasing access to care can occur. So it is on its way to the governor's desk. We really do see this as as APRNs, or advanced practice nurses, who are your nurse midwives, your nurse anesthetists, your clinical nurse specialists, and your nurse practitioners, are all they work, in primary care. They're working in acute care. They're hospitalists in some of they could be the only providers in our rural clinics. They are also, as Linda was sharing, in our educational programs, they are an incredible source of really helping the nursing student learn their role in the clinical experience. So we see this as something very good for the world of nursing, Wisconsin nurses, and that we really hope that we can get every nurse to contact the governor and ask that he sign on to this bill. It's I think it's time that the APRN role have a definitive license.
I know the governor's hearing from both sides of the issue on this issue. What are you hearing? If he's is he gonna sign it, or what are you hearing?
We don't know. We're hoping that he will. I know that you're right. He's hearing both sides of the issue. And the issues that are being raised, we have since 1995, the data to show that these advanced practice nurses are competent, they're safe. The governor has, during part of the emergency preparedness executive order, where the collaboration with the physician was no longer required. And you know, the sky has not fallen. And if anything, there's greater access taking place with our patients. So it's discouraging to see those, organizations that don't want this bill to pass.
Representative, you are a main sponsor of the bill. Linda, will come to you. Representative, you are a main sponsor of the bill. This has been opposed by doctors who argue that it would give too much authority too quick to nurses, would fracture team-based care. How do you respond to that?
Absolutely absurd. That is absolutely absurd to even mention any of this. We are a team within healthcare. Governor Evers trusted the nurses of Wisconsin during the emergency orders to work autonomously. This is what this bill does. He gave us these rights during the emergency orders because he knew that we were competent. And now we are asking for that to be continued, to continue to help with access and affordability in the state of Wisconsin. I have never done anything within the world of politics. I jumped into politics 100% for this bill. It is why I ran. I have fought hard down in Madison for this bill, and we are the closest we have ever been. Those 90,000 nurses that I talked about before, if every one of those 90,000 nurses called Governor Evers, there is no way he could not pass this bill. This is where I'm talking about the call of action to all the nurses out there. If everybody spoke up, the impact that we would have would be tremendous. But it's absolutely absurd to say that there are these concerns that the physicians are bringing up. Very disappointed that we worked together with these groups and we made amendments to this bill, and then in the end, they still are not supporting it. So I'm very disappointed in that. But I do believe that the governor will do the right thing for not only the nurses of Wisconsin, but also the patients of Wisconsin. This opens so many doors when we talk about access and the workforce for maybe the nurses that don't want to work at the large systems and want to branch off on their own. So as a business owner that owns my own clinic, I encourage other NPs and so forth and nurses to explore that. But you need to call the governor first to get this in play, or it's pretty darn impossible to do that right now with the way the statutes are written.
Linda, what impact do you think this would have on the workforce?
Well, I think it has a tangential impact in terms of education. So people who are in our DMP programs and our master's MP programs, they want autonomy of practice. So they're not looking to stay in Wisconsin until this changes. And we're hearing more and more of that to be the case. Additionally, to draw NPs to Wisconsin to teach or to work in healthcare systems, most NPs want autonomy of practice. So we're losing on that front as well. It is about getting healthcare to the greater good in Wisconsin, but we also need to think about the loss of people we're not getting staying here or deciding to come here because we don't have full autonomy practice in place. The situation in Eau Claire, our civil engineer and his wife, who was NP, they left Eau Claire to move to a state where she had autonomy of practice. She had hoped when they moved that was going to be passed. It was not passed in Wisconsin. We lost 2 professionals, and that's just one small example, but it is an example.
Thank you. Nancy.
Yeah, I think nurse practitioners bring huge value to healthcare. I think every one of us who are here probably has seen our our physician, and then every other visit you may see a nurse practitioner, and they are trusted colleagues. And I think every organization approaches this a little bit differently. And I want to take a little different twist. There are shortages in some of our specialty providers as well. And that's where nurse practitioners can be providers. And they also they have that nursing lens, which is a beautiful thing to combine all of that. So I would say they add value. And so this advocacy is great. And so I just wanted to mention that as well.
And if this bill was passed, do you think that would help with these shortages?
I think it would attract more people to become a nurse practitioner so that their opportunities for future employment are there. Again, it depends on how everyone approaches it. They work in collaborations with our providers. They are well-respected providers. And then, as representative, and then Gina, you have talked about, then there's opportunities for independence as well.
Pat, nurses nationally are gaining a stronger voice politically. The representatives calling for Wisconsin nurses to be even stronger politically. Nurse unions are also gaining a stronger voice across the country. You have led an effort to have UW Health again recognize a union for nurses, which has drawn the attention of area lawmakers as well as Governor Evers. What are the latest on those efforts?
Oh, we continue to fight. It is legal for the UW facilities to recognize a union. They are not required. We've had a bipartisan legislative group look at it, and they said it's very much legal. It's just a moral choice that UW needs to make, and the CEO Kaplan needs to make in order to recognize the union. And by having that union, you have a louder voice. Nurses together can working together with management can help solve a lot of these problems. We are the experts of bedside nursing, as many of the educators have stated. And, we're key for educating the new employees. We're key for educating the students. I myself have taken on single student preceptors for semesters, putting them into, giving them 120 hours of education one-on-one with myself to help them graduate. And these nurses need that voice. By working together, we can very much help solve a lot of these problems that we've talked about all the way through. We can help solve retention. We can help solve recruitment. We can help solve the education crisis and the educators crisis, but we can't do it by ourselves. We need to have employers, we need to have the politicians, and we need to have the nurses all having an equal voice and all coming to the table together to fix it. And that's one of the things I'm doing here in Dane County. I am working with the Dane County supervisors right now to develop a Wisconsin healthcare workforce trauma and recovery program to help get mental health for the nurses and the frontline workers, along with getting education, finding ways to draw some of the diverse population, bringing in educate some of the minorities that wouldn't necessarily come into the area. We're primarily a white workforce, and there's no reason for that. We need to get a much more diverse, culturally diverse group of people into the healthcare fields. And we have to find ways to do that, and we have to work together to do that. And as a union, we definitely have a voice at that table for that.
Nancy.
Yeah, thanks. Pat, I think you said something very important, that nurses want to have a voice, and we certainly know that nurses want to have a voice. At Children's, we don't have experience with unions here, and I do believe nurses need a voice. And so we have what's called shared governance. And I know many, many organizations have that. It's a magnet, American Nurses Credentialing Center verification. And that is the way nurses can have voice with their leaders, with each other, and with the entire teams. It's pretty powerful, the partnership councils and nurses who are at the bedside experts, subject matter experts on things, having a voice in decision making. So I think that's absolutely correct, that nurses want to have a voice, and the culture, as I've mentioned before, and then the shared governance methodology in which they can have a voice in, at least in our organization and others that have that infrastructure.
Pat, what do you think about that? With that shared governance concept, would that work at UW?
UW has a shared governance, but it's a very toothless meeting, because ultimately it's still management that makes that choice decision. And it needs to be an equal decision. And that's where the union voice comes into that, is it holds accountability to management to do what's right for the patient and the employee. And oftentimes we find where the decisions are monetarily based and not necessarily employee based. And that's part of the challenge with retention. That's part of the challenge with education. That's part of the problems with the whole. Shared governance has its place, unions have its place, and together we can make that voice accountable and work together. Because how do you hold, ultimately with shared governance, it's still management making that decision, which isn't wrong, but you need to take into account the voices of the nurses who are, again, the experts at the bedside, the experts at patient care. And that has to be used to help make those decisions.
Pat, UW Health maintains that its hands are tied by Act 10 and says the union should take this up with the legislature. How do you respond to that? I mean, have you tried going through the legislature on this? I mean, if UW has this hard stance, wouldn't that be the best route to go forward?
We're working on multiple levels, but we also know that currently many of the seats are held by the Republicans, and we have not been able to convince them differently. We are working with the governor, we're working with our legislators, and we are also working with the Board of Regents. And like I said, a bipartisan group we have had recommendations that say it is not required for legislation to change. It just has to be a choice that UW is willing to meet and negotiate a contract with manager or with the union.
Representative, what are your thoughts on union efforts by UW Health nurses and others?
Yeah, I think this goes back to what I mentioned earlier about people being politically exhausted, right?
Yeah.
I think a lot of nurses are realizing how much politics plays into healthcare, which is good and bad, quite honestly, right?
Exactly.
As I hear you speak, I mean, I haven't been contacted by anybody that I'm aware of to talk about this. You are right, it is really drawn on party lines. You're going to see that there would be pluses and minuses to UW hopping onto it. I'd love to discuss it with you further, but I know politically the challenges are there, right?
Mm-hmm.
But I'd love to hear what you would have to say and bring to the table, and maybe we can come up with something. I'm not sure how much support within the majority party right now would be for unionization, but that doesn't mean that there aren't other things that can be addressed. As mentioned earlier, I mean, is it a ratio issue? Is it a increasing the workforce issue? Is it a pay issue? Is it? Mm-hmm. I mean, there's so many other areas to explore too that might be, at least at this time, politically more feasible.
Great, Gina. Another thing that Pat brought up is the lack of diversity of the nursing workforce. The state's workforce, the country's nursing workforce is disproportionately white and female. What impact does this lack of diversity have on care? And as we try to regrow our workforce, what steps can be taken to make it a more diverse workforce?
Well, certainly, and this is through research and findings through national studies, but, there is, systematic racism also in healthcare, along with other, companies. ANA itself talks about, and other groups, that there's racism within nursing, which is kind of, for me, a bad thing to say out loud, but how else can we fix it? And it is about how do we continue to support the ability to eventually where our nurses reflect the patients that they care for in terms of the work that they're doing. And that does take, understanding when we looked at the whole emergency preparedness, what happened in the pandemic, I think we could have had, and in those populations where if we would have had more nurses that were looking like those populations, I think because they were trying to make a difference, there could have been a bigger, better outcomes. But it is, it's not, it's something that we all need to strive for, and really trying to work hard on. And I know a lot of the schools of nursing are taking on diversity and inclusion initiatives within their school programs, trying to take care and help support those nurses of color and other sorts of things where they can feel supported. I also know that a lot of our institutions, our acute care or long-term care, are all realizing that what an important issue this is and how to best try and make everyone feel that they're part of, equal part of the workforce.
Representative, what are your thoughts?
Well, I'm going to challenge that just slightly. When I taught at UW-Oshkosh and was doing admissions, there was programs that even gave preference to different races and to different gender. And so the challenge that we found at UW-Oshkosh was actually the applicants from the diverse groups. And so one thing that we did while I was there is that we started to reach out to maybe schools or different programs that had higher concentrations of different races and gender. There is stereotypes in nursing related to the male gender, or even culturally, some groups think of nursing in one form or another. So breaking those stereotypes and reaching out to the areas of diversity, we found was very important. It wasn't that, our program discriminated or the hospital discriminated against one race or another. It was just the amount of that particular group was not applying to the programs or showed less interest maybe in nursing than another. So I think UW, at least Oshkosh, and I believe the other programs have made strides to actually, in some cases, having preferred admission to diverse groups. And so I am challenging Gina just a little bit there.
Nancy, what do you think? Well, what steps is Children's taking to recruit and retain more nurses, and what more can be done to make it more diverse?
Yeah, I think really, everything that's been said is so important. It is a huge issue in the state, and we have not moved a dot on our, kind of demographics of our nurses in the state. It is really starting at a much younger age and getting out there in career fairs for not just nurses, but all healthcare professions, and really get some interest and then guiding people through. There's a lot of research done on grit, that perseverance that people have, meaning they need to have home care or the financial piece of this that just doesn't allow them to get through school. So how do we, with how we started this conversation, some more financial assistance, and then the preceptors and mentors for these folks. We actually have what we call a President's Nursing Scholarship, where we prioritize those scholarships to diverse candidates for our own employees to get them through graduation as a nurse. So we have to get innovative and creative there too, but it really is the support of the people who really desire to be a nurse or a healthcare provider, and mentor them through the process. And the financial piece is a huge issue as well.
Thank you. So we are quickly running out of time. This has been a great conversation. I think we could keep going for a lot longer, but I want to be respectful of everyone's time. So I want to end with one final question. I was hoping each panelist could take a minute, maybe looking at the clock, maybe half a minute, 15 seconds to answer this one. If you had to choose one, we've talked about a lot today and didn't get to a lot. What do you think is the most significant step that can be taken now to address the nursing workforce shortage? Pat, let's start with you.
I think we need to help the nurses heal in the here and now. We have a lot of nurses out there who are not working in nursing, and we need to bring those nurses back. And the question is, how do we do that? So we need to give those nurses a voice, and we need to bring forward bring forward a lot of those nurses back into the nursing field.
Thank you. Linda, what do you think? What is the most significant, or what is at least a significant step that could be taken now to address the workforce shortage?
Without pause, I say address the nursing faculty shortage.
Excellent. Thank you. Gina, what do you think?
Well, I do think culture change, knowing that I think nurses need to hear about some of the innovation that's going to need to happen. They're going to have to hear what's going to change in the workplace and what does it mean to me. You know, we lost probably some really good nurses, maybe just because of the physical demands of the job. So what does that look like? And, you know, and it's beyond our hospitals. We really do have to think about nurses are in just about every setting. And if they don't want to work in the acute care, then how can we encourage them to take a job in another area? I mean, there are so many opportunities. And to say I'm out of here, I would like to challenge those folks that saying I'm out of here. There's lots of other things where we could need your support and assistance.
Thank you. Representative, what do you think? What is one thing that can be done now to address the nursing workforce shortage?
Yeah. I think the image of nursing as a whole, nurses are caring, nurses are leaders, but right now, the general public sees nurses as warriors that are tired. And when people are looking for maybe a career change or what they want to be when they get older, nurses are exhausted and tired. You know, that doesn't look really appealing at the moment, even though it's an amazing profession. So getting out all the positives that nurses also do and how rewarding our job is, I think is essential to recruit people in ASAP. Because they're needed and there's great opportunity. But if we keep going with the negative image that we're giving, not negative nursing, but negative of the stresses and the hazards, I think it's going to be challenging to get people in. So being positive and moving forward.
Great. And Nancy, we'll give you the final word.
Sounds great. Ditto, 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 ditto. Thank you all. This has been really fun. I'm going to just add one more perspective because I do agree with all of you. Nursing is such an amazing profession, and I would encourage people to think about that and encourage their family members to think about it. My comment is really on the mental behavioral health aspect of what's going on in our state. And I do believe to keep nurses in nursing, we really have to think about that whole continuum of care. We have so many patients in all of our organizations across the state that are avoidable delays. They are in our beds, and they really need a facility that's going to give them the milieu of care that they can have, and that's mental health issues. So we are using our hospital resources, our nursing resources in our hospitals that really we need to think about what are those post-acute settings, what are those group homes and other types of facilities that we can better care for the mental health issues in our state and have the right people to do that type of work. So it's more than nurses, but I do think that's going to be a huge plus for nurses who are frustrated because we're needing to provide continuation of care when we know that they need to get into the next level of care, which is better for their mental health. And so that's another hour discussion probably, but I do believe that that is another piece that we can address. And I agree with what everyone else has said. This has just been really fun. And thank you to all the nurses who are out there in all different realms, in healthcare settings, in politics, in schools of nursing, et cetera. We have an amazing career, and we need to shout it out. So like you said, Rachael, let's get those voices going of the 90,000 people that currently are in these positions.
Well, thank you, Nancy. It's actually a great segue. Our next event will be next month in person in Milwaukee, focus on mental health. We're not paying Nancy to say that, but Nancy, thank you so much. Thanks to all of you guys. This has been a really great conversation. Thanks to Anthem, our sponsors, for making it possible. And thank you all. We'll see you again soon.
Thank you.